Welcome to the Hospital Finance Podcast, your go-to source for information and insights that can help you stay ahead of the challenges impacting healthcare finance. And now, the host of the Hospital Finance Podcast, Michael Passanante.
Hi, this is Mike Passanante, and welcome back to the Hospital Finance Podcast. Now, it's no secret that healthcare has been on the minds of lawmakers in Washington with some major legislative pushes in the past several weeks, culminating with the deadline of September 30th for action on several fronts. And to break all of that down for us today, I'm joined by Mike Merola, founding partner of Winning Strategies Washington, a leading government relations firm based in Washington, D.C., that specializes in hospital issues. Mike, welcome back to the program.
Thanks for having me, Michael.
So, Mike, let's start out. The Gramm Cassidy bill made headlines in the past couple of weeks, and as we know, it did not pass. Can you explain what that bill was intended to do and what the downfall of it means?
Sure, happy to. I think the bill, like all of those that came before it in both the House and the Senate this year to try to repeal and replace Obamacare, represents the triumph of politics over policy. This bill, again, laid bare the divisions in the Republican Party between, I think, the majority, or at least the majority in Congress, who believe that healthcare is a commodity like any other, like a Cadillac, and you're really only entitled to the amount that you can afford, versus those in the Republican Party who think in a country as rich as ours, we should be able to provide some bare minimum of care to everyone. The bill essentially would have done, it was very similar to what all the other bills that your audience has read about this year would have done. The format was essentially the same. It would have given states more control over healthcare by allowing them to waive the pre-existing condition coverage requirement, allow them to opt out of essential health benefits, and overall would have devastated Medicaid funding. Over time, it would have turned it into a block grant. I think there wasn't a single stakeholder group that supported it, and so I don't think we were surprised that they had the same outcome with this bill that they did with the others.
Mike, let's turn to DSH. $2 billion in DSH, or disproportionate share hospital payment cuts, were set to begin on October 1st. Can you explain what is happening with that now?
Sure. Just as a quick reminder, this is CMS following through on an Affordable Care Act requirement to cut Medicaid DSH payments to hospitals by over $40 billion from fiscal year 18 through 2025. Much like the doc fix that we used to deal with every year to restore higher Medicare reimbursement for doctors, this has become sort of an annual ritual in Congress now where we delay these cuts for a year or two. The current amendment that's pending would push these reductions off by another 2 years. I made a round of phone calls to majority staff in the House and the Senate on Friday, and they were very reassuring in that it's a matter of when, not if, even though these cuts went into effect on October 1, they will reinstate them retroactively in terms of the reimbursement. But it's just unclear when Congress can get around to getting them done because they want to move them with some other pieces of healthcare legislation, like the CHIP, the Child's Healthcare Insurance bill that's being marked up in both the House and Senate this week. So I think they're hopeful that they can turn it around. They haven't figured out exactly how to pay for this latest round, but their hope is that maybe this week they can resolve that, get CHIP out of committee, and then sort of attach the DSH provision to that, and then in the near term here get the funding restored for hospitals.
Thanks, Mike. A few days ago, the president said that he anticipates issuing an executive order allowing insurers to sell coverage across state lines. What can you tell us about that?
Sure. Most of the insurance policy experts that I talked to on the Hill last week when I realized you wanted to talk about this are really stumped by this because an executive order, almost to a person, they said will not preempt state law on this, and this is all governed, health insurance right now is all governed state law. So I think in and of itself, it's not going to have that much of an impact, and most of your audience probably knows that there was a provision in the Affordable Care Act that allowed states to create compacts and to allow insurance to be sold across state lines. And while several states pass laws in their individual capitals to allow it to happen, it hasn't happened yet. And I think that's for a couple of reasons. One, the state insurance apparatus has vehemently been opposed to making this into a federal issue. They want to retain state control. They feel like local control is better control. For states like New Jersey, New York, California, that have sort of higher standards, a more robust benefit, they're concerned that there could be a race to the bottom if suddenly states like Alabama or others, not disparaging them, but they just have a different standard in terms of the benefit package, that there'd be a race to the bottom and sort of in states with that significant of a dichotomy. And because all healthcare is local, if you're an insurance company in Florida and you want to offer a plan in Montana, you're not on the ground there. You don't know the network, you don't know the docs, and it's a challenge to sort of put that together from that distance. So there's been some speculation. The president's EO hasn't come out yet, but that it might be focused specifically on association health plans, and that it may give that model a boost. But I think, without actually seeing it, it's hard to speculate. But I don't think it's going to have much of an impact at all.
And on a bright note, the Senate did manage to pass a bipartisan bill called the Chronic Care Act. Can you tell us what the intent of that bill was and where it's headed next?
Sure. I mean, this is really how health policy should be done. This was more than a 2-year bipartisan effort. They had a significant amount of hearings. They engaged stakeholders. If Congress could only apply this template to the Affordable Care Act, we could have avoided the past sort of year of angst and ultimate failure for the Republicans. So basically, it looks at it's trying to deal with the fact that so many Americans are suffering from conditions like diabetes or heart disease that are just very expensive and last a long time. So the bill's multifaceted, but it looks at things like making use of telehealth, expanding the Independence at Home program that allows seniors to receive their care at home as opposed to the hospital, so a more inexpensive setting, and then sort of streamlining Medicare and some of the Medicare Advantage program to try to give better care at lower cost. So it'll go over to the House now. The House has decided that they don't want to do one big bill. They're going to sort of try to digest it in smaller pieces. And so they're in the process of doing that now. I don't think it'll get done before the end of this year, but the hope is that before the end of this Congress, at the end of 2018, that they'll get it done.
Of course, some major news last Friday was the resignation of HHS Secretary Tom Price. Without delving into the reasons for his resignation, can you tell us where things stand and where they might be headed?
Sure. We have a new acting Secretary of Health and Human Services. His name is Don Wright. He's a family physician and has been in the federal government going back to the George W. Bush administration. This is obviously the most senior position he's had. So I think he is not a known entity to the Hill, so he's going to have a bit of a learning curve there in dealing with Congress. What I've heard, this all happened so late in the week. I tried to reach some folks over the weekend and this morning, and they seem to think that ultimately the president will nominate someone who just recently received Senate approval, maybe like Seema Verma at CMS or the VA administrator, although he has maybe the same issue dealing with commercial or charter flights to Europe that former Secretary Price did. So everybody's waiting to see what happens. But the agency is still running, with the acting secretary in charge right now.
Mike, what's left in 2017 as far as healthcare goes, as far as Congress is concerned?
Well, they're going to, once they get CHIP done, they have to pass the Medicare extenders bill. That'll probably happen before the end of the year. And that's probably it, to tell you the truth. There's some talk that there was a bipartisan effort to provide some financial subsidies to the insurance market in September before the Graham-Cassidy bill really got the momentum that it had there over the past 10 days. So they may revive that as well, but there's so much bad blood in the Senate right now over the Affordable Care Act that they may just sort of set it aside. Senators Gramm and Cassidy came out at the end of last week and said that they were going to make a big push to get health care attached to tax reform. I'm not sure that's a smart idea because there's no consensus on health care, and they seem at this point, even though it's at a high level, to have some consensus on tax reform. And so I could see where healthcare could drag tax reform down if they link the two. So I think we have to wait and see ultimately what they decide to do. I think, in my personal opinion, is the Republicans have been determined to commit hara-kiri on this issue all year, and so and it just in the crazy world of Washington these days, I don't think you can rule anything out. So they very well may try to attach another repeal and replace bill to tax reform sometime early in the new year.
Mike, as always, thanks for providing clarity and focus on all of these many issues that are going on at the federal government level. And thanks for coming back to the Hospital Finance Podcast.
My pleasure, Michael. Thanks for having me.
If you enjoy the Hospital Finance Podcast, please head up to iTunes to subscribe and leave us a positive review.
This concludes today's episode of the Hospital Finance Podcast. For show notes and additional resources to help you protect and enhance revenue at your hospital, visit Bessler.com/podcasts. The Hospital Finance Podcast is a production of Bessler. Smart about revenue, tenacious about results.